Are you always burdened by script writing? Are you often confused about the type of script to use? Does script writing raise your blood pressure? Are you always interrupted to fix your faulty scripts? If the answer is yes, then to make it easier, presenting your pharmacist.
Hi, I'm your pharmacist. Let us get started. Step 1. Know your script. There are two types of script forms. The PBS, so-called external script, and the internal script, also known as the hospital script. Let us begin with the internal script. It is used for both non-S8 and S8 medications, both discharge and outpatient scripts. It is supplied by the hospital pharmacy. When you write the script, you give the white to the pharmacy and put yellow in notes. Let us focus on the rules of an internal script when used for discharge. You can only write a maximum of 4 items on one script. Only new medications are candidates for discharge script. Be aware of the different formulations available for a drug. Know your patient's needs and ask them plenty of questions. Always round off the doses. Discharge medications are free of charge for less than or equal to 7 days of supply. A patient's regular medications are not discharge medications, as they may have alternate arrangements for them. Discharge is for less than or equal to 7 days. However, some exceptions apply. Exceptions for discharge script when it can be for 30 days and maximum 2 repeats are non-PBS items, larger than PBS quantities, Children's Hospital Westmead manufactured items, and non-PBS approved conditions such as cystic fibrosis, oncology, or psychiatry. In these cases, standard outpatient charges will apply. This is what a complete script looks like. Here, all the columns are neatly filled. Don't forget to write the current weight and allergy status of the patient, as this is important for dispensing. For future reference, see this poster in the doctor's room, which clearly explains each step. Now, let's see the use of the same form for an outpatient script. Use this form for an outpatient script for medications that are supplied by the hospital pharmacy, which are not readily available at community pharmacies, are larger than PBS quantities, are non-PBS medications, or are Children's Hospital manufactured items. Once again, standard outpatient charges will apply. This is what a completed outpatient script looks like. The internal script is also used for S8 medications. The rules for writing an S8 script are that only this form can be used for S8 medications. All columns must be clearly handwritten and completed. The law does not allow for patient ID stickers or addressograph labels to be used. You must write the details of only one drug per script, and the total quantity must be written in both words and numbers. The duration for a discharge script is less than or equal to 7 days, whereas the duration for an outpatient script is 30 days and maximum 2 repeats, with the repeat intervals specified clearly. You must sign, print your name and date the script, because without it, the script is invalid. This is what a completed S8 script looks like. Remember to write the total quantity in both words and numbers. For future reference, see this poster in the doctor's room, which clearly explains an S8 script. You may also use this detailed video that explains the entire process of writing an S8 script. Let's move on to the second most common script used in the hospital, the PBS, also called the external script. When using the external script, you must refer to the PBS website via the Children's Hospital intranet page. If your patient satisfies the criteria, then use this script where possible. You must complete all columns of the script. as well as writing the weight of the patient next to the name. Remember to sign and date the script, and give both copies to the patient. This is what a completed external script looks like. Don't forget to write the weight, as there is no special column for it. For future reference, see this poster in the doctor's room. To be successful in script writing, you must choose the correct prescription form for the type of script you wish to write, and always complete every column on the script. If you need help with any part of script writing, then contact your ward pharmacist, or ring the pharmacy at 52700 or 52696. Thanks, and I hope you enjoy script writing from now on.